Hello everyone, now let us discuss about CPT coding guidelines for anesthesia, part 1. So first of all, what is anesthesia? Anesthesia means administration of drug to induce partial or complete loss of sensation. And when it comes to current procedural terminology, CPT, the code range for anesthesia is 00100 to 01999, that is from 100 to 1999. These are the code range for anesthesia. Usually anesthesia, these codes are used by anesthesiologist and CRNA, Certified Registered Nurse Anesthesiologist. And usually in CPC exam, we will be getting around 4 questions from this topic. Now coming to the checklist for CPT. Before reading any CPT code, we must consider 3 points. The first point is read a complete CPT code. The second is see for any symbols in front of the code. We have to look for symbols in front of the code. The third is check below the code for parentheses, because the parentheses, they enclose additional information. These are the 3 points that must be taken into consideration before governing a CPT. So first, read a complete CPT code. What does that indicate? We have to first determine whether a specified code is complete or incomplete. For that case, whenever there is space after the code, in the CPT book, it indicates that that specified code is incomplete. Here you can see an example. Code 00162. You can see a space after that code. And the second point is the descriptive term, it is starting with lowercase, radical surgery. So here the description is incomplete. Whereas if you see 00160, here you can see the first word is starting with capital letter. Anesthesia for procedures on nose and accessory sinuses not elsewhere specified. This is a complete and standalone code. Whereas 00162 code has incomplete description. So how should we read 00162? The correct definition of 00162 is anesthesia for procedures on nose and accessory sinuses, radical surgery. Now coming to the second point, see for symbols in front of the code. You can find various symbols which will be discussed later on. As of now, let us see an example. Whenever you assign a code, you have to look for any symbols in front of the code. As you can see here, in front of 01968, there is a plus symbol. The description for 01968 is anesthesia for cesarean delivery following neuraxial labor, anesthesia or analgesia. Here you can even find parenthesis below the code that indicates list separately in addition to code from primary procedure performed. Whenever there is a plus symbol in front of any code, that is an add-on code. That is, it is not a primary code and it is always a secondary code. Before that code, a primary procedure code must be added. Here the primary procedure code is 09167. Neuraxial labor, analgesia or anesthesia for planned vaginal delivery. So plus indicates add-on code. Similarly, various symbols indicate various reasons which we will discuss later. Next is check below the code for parentheses. Here you can see parentheses, they enclose additional information. So first we have to read a complete CPT code. Next we have to see for symbols in front of the code. And finally we have to check below the code for parenthesis. So this is how you have to see a CPT. Now coming to types of anesthesia services which are billable. There are various types of anesthesia services. Only some services are paid. That is nothing but they are billable. Now let us discuss about the billable anesthesia services. The billable anesthesia services are general anesthesia, regional anesthesia and monitored anesthesia care. General anesthesia is usually administered through inhalation or IV. Regional anesthesia is again divided into spinal, epidural or nerve block. Spinal is nothing but intrathecal. So the billable anesthesia services are general anesthesia, regional anesthesia which includes spinal or intrathecal anesthesia, epidural anesthesia and nerve block. And finally monitored anesthesia care. Now coming to anesthesia services which are part of a surgical procedure. The anesthesia services which are not billable or simply which are included in the procedure itself. They are local anesthesia, topical anesthesia and self-control anesthesia. Services that are included and excluded from anesthesia. During any procedure or any surgery, there are a specific set of services that are performed to the patient. Some services are included within the surgery package and some services are excluded. That is, they can be coded separately. So let us discuss the services that are included and excluded from anesthesia. First, let us discuss about included services. That is, these services need not be coded separately. Example are usual pre-op and post-op care during a procedure, anesthesia care during the procedure, administration of fluids or blood, and usual monitoring services like ECG, temperature, oximetry, capnography, mass spectroscopy. These are the services which need not be coded separately along with anesthesia code. Now coming to the examples of services that are excluded. That is, they can be coded separately if it is performed by the anesthesiologist. These services can be coded separately if they are performed by anesthesiologist. Example are intra-arterial line placement, central venous line placement, and Swan-Ganz monitoring. These are some of the examples of codes that can be coded separately in addition to anesthesia code. Now coming to the formula for calculating the charge for anesthesiologist. The formula is base plus time plus modifying factor. Finally, total units into conversion factor. This is the anesthesia formula. So first coming to time reporting. How will we report the time? Anesthesia start time is nothing but anesthesiologist is preparing the patient to induced anesthesia. During the procedure, the time continues and the time will end when the anesthesiologist left the patient. Right from the start of anesthesia till the anesthesiologist left the patient is nothing but anesthesia time. And every 15 minutes equals to 1 unit. And the modifying factor is based on status P indicators and qualifying circumstances. Status P indicators and qualifying circumstances are discussed in the next session. So as of now, for here, the modifying factor is based on status P indicator and qualifying circumstances. Now let us look at the examples for anesthesia start time. Here the anesthesia start time is reported as 7:14 am and the surgery began at 7:26 am and the surgery finished at 8:18 am. and the patient was turned over to PACU at 8:29 a.m. What is the anesthesia time reported? As we have discussed earlier, the anesthesia time is nothing but right from the induction of anesthesia till the anesthesiologist left the patient. That is from 7:14 a.m. to 8:29 a.m. which is nothing but 75 minutes. Now let us see one more example. A pre-anesthesia assessment was performed and signed at 10:21 a.m. pre-anesthesia, which is nothing but the assessment was before the induction of anesthesia. So anesthesia start time is reported as 12:26 p.m. and the surgery began at 12:37 p.m. Surgery finished at 15:12 p.m. and the patient was turned over to PACU at 15:26 p.m. which was reported as the anesthesia ending time. Here the anesthesia time is nothing but from 12:26 because the anesthesia start time is 12:26 p.m. to until the patient was turned over to PACU, that is 15:26 p.m. From 12:26 p.m. to 15:26 p.m. which is nothing but 180 minutes. This is how we calculate the anesthesia time. Now let us look at the example for calculating the anesthesia charge. The formula is base value plus time plus modifying factor, which gives total units. That total units into conversion factor will give the anesthesia charge. So every 15 minutes of the anesthesia time equals to 1 unit, and the modifying factor is based on status P indicators and qualifying circumstances. Regarding the status P indicators and the qualifying circumstances, we will discuss in the next session. So let us look at an example. Code 00350, which is nothing but anesthesia for procedures on the major vessels of the neck not otherwise specified. This procedure has a base value of 10 units. Base value will be given in the question only. So this procedure has a base value of 10 units which will come under this base value. And the patient is a P3 status. P3 is nothing but a P indicator which allows one extra base unit. This one extra base unit comes under the modifying factor. And the anesthesia time, start time is reported as 11:02 a.m. That is, it began from 11:02 a.m. The surgery began at 11:14 a.m. The surgery finished at 12:34 p.m. and the patient was turned over to PACU at 12:47 p.m. which was reported as the ending anesthesia time. Using a 15-minute time increments and a conversion factor of $100, what is the correct anesthesia charge is the question. So here the formula is base value plus time plus modifying factor. First let us assess the time. Anesthesia start time or the total anesthesia time, which is nothing but 11:02 a.m. to 12:47 p.m. Anesthesia start time is 11:02 a.m. and the patient was turned over to PACU at 12:47 p.m. So the total anesthesia time is 11:02 a.m. to 12:47 p.m. which is nothing but 105 minutes. Here each 15 minutes equals to 1 unit. If you divide 105 by 15, the total number of units will be 7 units. This will be taken under time. So first 10 base value units plus 7 time plus 1 modifying factor, 1 unit for modifying factor because he is a P3 status which allows 1 extra base unit. So 10 plus 7 plus 1, total are 18 units. Total units 18 units into $100 which is nothing but $1,800. $1,800 is the anesthesia charge in this particular scenario. Now let us discuss one more example. Code 00940 anesthesia for vaginal procedures has a base value of 3 units. The patient was admitted under emergency circumstances. The qualifying circumstance code 99140, which allows 2 extra base unit. Regarding the qualifying circumstance also we will discuss in the next session. Here this qualifying circumstance, because the patient is admitted under the emergency circumstances and the qualifying circumstance code 99140 allows 2 extra base units, this can be taken under modifying factor. 2 extra base units under modifying factor. And a pre-anesthesia assessment was performed and signed at 2 a.m. Anesthesia start time is reported as 2:21 a.m. Start time is reported as 2:21 a.m. The surgery began at 2:28 a.m. The surgery finished at 3:35 a.m. and the patient was turned over to PACU at 3:36 a.m. which was reported as the ending anesthesia time. Using 15-minute time increment and a conversion factor of 100, which is the correct anesthesia charge. Here we all know the formula is base value plus time plus modifying factor, which gives total number of units. That total number of units into conversion factor will give the anesthesia charge. So first we'll calculate anesthesia time. That is from 0 to 21 a.m. because the anesthesia start time is reported as 2:21 a.m. So from 2:21 a.m. to 3:36 a.m. which is nothing but the end anesthesia time, which leads to 75 minutes. Total number of units are 5 units. So the total anesthesia charge is 3 base value units because this code has 3 base value units, 3 plus 5 for time plus 2 for modifying factors, which is nothing but the total is 10. 10 into $100 is nothing but $1,000. So $1,000 is the anesthesia charge in this particular scenario. Thank you for watching. Please subscribe for further videos on medical coding and CPT.